Hi, I'm Dr. Scott St. Amour.
And I'm Dr. George Rogu from RBK Pediatrics, primary care when you want it, urgent care when you need it.
So we put this video together for you just in anticipation of coming in with your 9-year-old child for their well visit this year. We just wanted to make sure that you kind of knew what to expect when you came on in. We're going to spend some time catching up on everything that's been going on over the past year, everything at school, at home, any medical issues, any new allergies, medications, subspecialists, hospitalizations, surgeries. We want to make sure we're completely up to date with everything that's been going on. The growth curves, still by far the most important thing we look at these visits, making sure your kiddos are growing and gaining weight properly. We review the appropriate developmental milestones, see how they're doing in school, and of course, give them a nice full physical exam. So 9-year-olds, making sure they're staying active is very important. What kind of advice do you like to give the parents for this?
Well, 9-year-olds, they're bigger, they're stronger, they're faster. They need a lot of outdoor physical vigorous activity, at least 1 hour a day. And in order to do this, a lot of people on Long Island, they'll sign their children up for soccer, little league baseball, basketball, lacrosse. And if they have 1 or 2 practices a week and a game during the weekends, and then maybe a little bit of practicing in the backyard, that's a lot of activity for a child. But I'm talking about real soccer, not FIFA video game soccer.
Right. The organized sports are very good for the kids at this age. They teach them discipline. They teach them being part of a team, teamwork, responsibility. And it teaches them that if they practice something, they get better at it. These are all very important lessons for the kids that help make life a lot easier for them as they get a little bit older. We are huge fans of organized sports for the kids at this age.
Yes.
We also talk a lot about nutrition at this age too, trying to get the good habits in for these kids who are going to be teenagers very soon and doing a lot more on their own. We want to make sure that we continue to give them a nice, healthy, balanced diet so that that's what they're used to eating. That's what they're going to wind up craving as they get a little bit older. We want to continue to discourage the sugary drinks, the sodas, the juices. Our bodies don't do anything with that nutritionally. It all just gets put right on top. Sleep, very important too. What's the advice for sleep at this age, Dr. Rogo?
Well, at this age, they're growing, so they need the sleep in order to grow. They need about 9 to 12 hours of sleep a night. And the most important thing about sleeping in children is they need a consistent bedtime to go to sleep, and they need to wake up around about the same time. And the room should be comfortable, quiet, free of distractions such as TVs, video games, phones, or other things. Because while you may think that the child went to sleep, if the phone's in his room, I promise you, that child is on TikTok or on YouTube or on something, and they're just staying and their mind is going and they're just scrolling and scrolling and scrolling mindlessly, and they're not sleeping.
Kids will be kids. When it comes to the safety, again, they're 9 years old and they're about to become a lot more independent over the next few years. It's really important that we spend the time making sure that we get these good safety habits and get them thinking about the safety everywhere they go. Making sure they're using their seatbelts when they get in their cars, wear their helmets when they're on their bicycles, their scooters, making sure they're obeying the traffic laws, looking both ways before they cross the street. The internet can be a very dangerous place for kids. Make sure that you're keeping all of the internet blockers and content blockers and adult screens and stuff like that always on their phones and their tablets and stuff like that. And make sure you're monitoring their social media use also. There are a lot of bad people out there who have very bad intentions for the kids, and it is very difficult to protect them from that.
Yes.
Reinforcing the rules of safety at home too, making sure the kids know what to do when they don't know what to do. Calling 911, the police, the fire department, the doctor is very important to continue to review with the kiddos. When you talk about trying to foster good social development with the kiddos, what kind of stuff do you like to talk about?
Well, you should always encourage positive social relationship with other children, empathy, and respect for everybody around you, from the other children's point of view to your parents and your elders. Always respect your parents. They should learn to develop and manage their own emotional stress and conflicts. You should not allow a older child to, if they don't get what they want, they go into these meltdowns and temper tantrums. Yep.
Yeah, those are deadly at this age. And it's just all about them learning how to deal with the word no.
Yes.
You know, it's going to happen the rest of their lives, and they need to learn how to deal with that nice and early. We still recommend dental checks every 6 months for the kiddos at this age. We recommend a good fluoride toothpaste for them and get them brushing it twice a day, every single day. Keep those good habits in place. For the behavior, it's important that we continue to encourage the kiddos to do the things that we want them to do: reading, writing, art, music, stuff like that, rather than just sitting on the couch watching TV or doing stuff like that. Giving them puzzles to do, helping them with problem solving, and stuff like that is very, very important. What kind of ways do you like to encourage independence in the kids at this age?
Independence, you have to get them to do creative stuff. They can learn they can learn arts and crafts and independently learn to do arts and crafts and music. You get them to do their own homework and try to get them to do their assignments, organize their room, clean up their room, and encourage self-care, taking a shower, simple things.
Yeah, responsibility. They are old enough now, definitely.
Yep.
The screen time, we talk about this to death. We like to encourage no more than 2 hours of screen time a day. We do not want the kiddos just sitting on the couch watching TV or anything like that. We want them learning stuff. This is a critical period for them in the learning and their brain development. So just make sure that they're not just wasting a lot of time sitting around. Make sure they're learning stuff. They're doing stuff. Throw them outside. Get them running around outside in the sun. It's good for everybody.
Yes.
Can you talk to us a little bit about the vaccines and the blood work at this age?
Well, at 9 years of age, most of the vaccines are already up to date, especially at our practice. But if there's something that's missing or you came from another practice or another country, we will do a catch-up vaccine schedule. The flu vaccine, the seasonal flu vaccine, should be given to your child, usually in the late August through December, January, February months. Lab work may be recommended based on the discussion that we have with the child, the growth charts. If they're gaining too much weight or they're not gaining enough weight, we might look for problems or if there's any symptoms, and a tuberculosis test may be required by the school.
Mm-hmm.
Yes, but get your flu shot.
Highly recommended.
Yes.
Thank you guys for listening to us with this video here. Hopefully you have a better idea of what to expect when you come on in. It's going to be a whole year before we see you again, but always remember, we are always around for you. We are primary care when you want it, urgent care when you need it. Call us 24/7. We have doctors on call. We are always here for you. Thank you, and we look forward to seeing you when you come on in.